Hello, everyone. I'm Rajiv Dasgupta from the Center of Social Medicine and Community Health, JNU, and the co-investigator of the UKRI-GCRF One Health Poultry Hub. On behalf of the One Health Poultry Hub, welcoming you to the Roadmap Series 2 India Webinar 2, Balancing Food Security with Animal and Human Health in India. Can a One Health framework meet the challenge? We have two very eminent speakers, Dr. Sandeep Ghatak, Principal Scientist, ICAR for NEH region, and Dr. Vikas Agarwal, South Asia Regional Lead, Fleming Fund Grants Program at McDonald, and a very able moderator, Dr. Anuradha Jain, Senior Advisor, Health System Strengthening, the USAID, New Delhi. At this point, I welcome Professor Fiona Tomley, the Principal Investigator of the One Health Poultry Hub from the Royal Veterinary College, London, to give an overview of the One Health Poultry Hub and the India Roadmap series. Professor Tomley, please.
Thank you very, very much, Rajiv, and welcome everybody to this webinar, which is being organised by the India chapter of the One Health Poultry Hub. I've just been asked to say a few words about the hub, and just to put some context in place, the One Health Poultry Hub is one of 12 interdisciplinary research hubs that is funded by UKRI. It's an investment of over £200 million by UK government, and the hubs are each tasked with looking at a major global challenge, and we, of course, are looking at the externalities that affect poultry production. And the hubs overall, you can see the number of organisations that are partnering to these 12 hubs around the world, and there is very much a focus in Asia, and there's a lot of activity going on in the different countries in South Asia. Our hub, the One Health Poultry Hub, what we're looking at is trying to work with very eminent people all around the world, looking at how we can work together for safer and more sustainable poultry production. We're working, our study countries are India, Bangladesh, Sri Lanka, and Vietnam. And on the screen now, you can see all of the 27 partner institutes who are working on this hub. So it's no surprise why we're working on poultry production. You can see in blue on this graph the rate of expansion of poultry production, particularly chickens, has been exponential over the last few years, and it's predicted to increase. And much of the predicted rise that is ongoing at the moment and will continue over the next 20 to 30 years will be occurring in Asia. This is, of course, this rush for intensification and expansion is meeting the nutritional needs of the population, but it doesn't always come without problems. And the production practices across all of the different types of production are very complex. There's lots of steps between farming and the consumer. And as we know, in many countries, there's poor regulation of antimicrobial use, and in some sectors, low biosecurity and hygiene. And there's been a lot of work because of the COVID outbreak, a lot of publicity about live birth markets and consumer behaviours. And again, that's something that within our hub, we are looking at what are the behaviours, what are the preferences, and what are the constraints upon implementing safer practices. In our hub specifically, we are focusing on 3 particular areas of interest, all of which are potential zoonoses that can transmit from chickens to people, avian influenza, which, as we know, is raging through the world at the moment, particularly in the Northern Hemisphere, bacterial foodborne infections, and we have a particular focus there on non-typhoidal salmonella and campylobacter, but also in coli. And a very big part of what we're looking at is antimicrobial resistance and the factors within chicken production that are maybe influencing and exacerbating the origins and the transmission of antimicrobial resistance genes in poultry production. So this webinar is one of, I'll just stop sharing, is one of 2 in this series. Up between 21 and 22, the hub ran a series of 18 webinars which went out globally And as a result of that, each hub in each of our study countries, including in India, did a lot of work to decide on where the priorities were for their team and how they might take this forward in their own country. And this roadmap series 2 in India is a result of a lot of synthesis work done by Professor Dasgupta and others in India. And I'm really delighted to be here to listen to the second one on balancing food security on animal and human health. So thank you, Rajat, for letting me have these few words, and I hand back to you.
Thank you very much. It's my pleasure to introduce our moderator today, Dr. Anuradha Jain. She's a clinician with a formal training in public health and been a public health practitioner for the last 15 years. She has served in various national and international organizations and contributed to the conceptualization and operationalization of some of the national flagship programs in India. For the last 8 years, she has been working with the United States Agency for International Development and providing strategic oversight to the USAID's largest health system strengthening portfolio, and also the USAID's COVID-19 pandemic response support for India, which is over 200 million USD plus investment. This portfolio includes techno-managerial oversight to projects working on CPHC, the oxygen ecosystem, the essential public health functions, and global health security. Dr. Jain, thank you very much on behalf of the One Health Poultry Hub. Over to you. And I hope the attendees will greatly benefit from this afternoon session. Dr. Jain, please. Thank you.
Thank you, Dr. Dasgupta, for that welcome and introduction. Hello, everyone, from a sunny afternoon in Delhi, winters of Delhi, and good morning, good evening, wherever, in whichever part of the world you are at this point of time. And in your screen, immediately, you would see a poll for exactly 1 minute, and you can please help yourself answer this poll, and we would announce the results of the poll after our first speaker, Dr. Sandeep Ghatak, whom I am just going to introduce to you, would finish his presentation. So let me introduce you to our very, very eminent speaker, Dr. Ghatak, who is the principal scientist in veterinary public health in the Indian Council of Agriculture Research Complex in the NEH region of Meghalaya. His research interest focuses on genomic epidemiological studies of antimicrobial resistance in bacteria. Following the One Health approach, he and his team members from diverse backgrounds gather and analyze data, evidence that help explain the transmission dynamics of drug resistance at the interface of human, animals, and environment. To understand and visualize the bacterial genomic data, he often resorts to bioinformatic tools that complement the vet lab data for better communication to broader audience. So welcome, Dr. Ghatak. And I would also like to introduce another eminent speaker of ours today, who's Dr. Vikas Agrawal. Dr. Agrawal is a regional health lead, South Asia for Mott MacDonald, a multidisciplinary consulting and management firm. Dr. Agrawal, in addition to being a regional director in Asia for Fleming Fund, his prime role is to overall manage and coordinate UK aid-supported Fleming Fund investment in Asia region, which aims to tackle AMR through strengthened surveillance of AMR through One Health approach. In addition, he also manages Fleming Fund strategic alignment grants and which are implemented across Asia and Africa. Dr. Agrawal is a medical doctor by specialization in public health management. He has vast experience of designing, managing, and leading health and development projects that focused on health system strengthening, One Health and AMR disease control and prevention, community empowerment, health system strengthening, improving access of the communities to health information, and services through bridging the gap between supply and demand are some of the areas where Dr. Agarwal has been contributing for the last many years. So welcome, Dr. Agarwal. And over to you, Dr. Sandeep Ghatak, for your presentation. Thank you so much.
Thank you, Dr. Anuradha. It's a pleasure to be here. Thank you, Professor Rajiv Dasgupta and Professor Fiona. I would ask Dr. Pallavi, will these poll results stay here or can I close it? Oh, thank you. Thank you all. Thank you, my esteemed colleagues from the Royal Veterinary College, led by Professor Fiona, and many others are there, and our moderator, Dr. Anuradha. With the permission of this house and all others, I would like to switch off my video so that the connectivity stays better and stable. Well, One Health, when the Professor Dasgupta's team approached me that can we have a talk, I just felt so privileged that this is really a good opportunity to put forward the One Health that we had been trying to practice in this vastly diverse country of India for so many years. And when the global momentum has taken up, this One Health Poultry Hub initiative does reflect that it is important and it is moving in the right direction. Interesting is the topic of the webinar, that balancing food security with animal and human health in India. Can a One Health framework provide the unifying framework? Well, it is very interesting in this sense, because if we look into the literature who had been who, especially many of us who are trying to practice One Health with a greater vigor, the thing is that we see that many discussions are available on food safety aspects, hardly anything on food security side. So it is important. So in this today's discussion, as I'm going to present, our structure will be, can I have the next slide, Dr. Pallavi? Outline that we would look into the basic philosophy that we all do know, that the philosophy of One Health, but it would be interesting to see that again, because that it highlights that we had it, but we lost it sometime. Then we'll look into briefly into the role of the livestock in food security, the status of India in livestock, the existing animal and human and other health systems in India, and what are the existing intersectoral collaboration and the One Health initiatives that are in place, whatever be that. And then we will go ahead with whatever the animal health challenges, especially where we may require the One Health intervention. This is important because healthy animals leads to healthier production system and healthier humans ultimately. Thank you. But before all these, I must concede that this is not a lecturing series, lecturing from my side. I'm just sharing my ideas and knowledge that I have. And in turn, I would love to hear from the audience and esteemed panelists. Next, please. Well, One Health, though these two terms does not indicate, but it had always been collaborative and cross-talking. Why is it collaborative and cross-talking? There had been many evolving definitions of One Health, right from one that was started by CDC in 2018, 4 years ago. Now the One Health high-level expert panel came out with a definition that says that it's integrated unifying approach that aims to sustainably balance and optimize health for all life forms, people, animal, and ecosystems. So essentially, it is a collaborative in nature. It requires participation from all sides, and health of all life forms, environment is intricately linked. This particular idea is recognized by the One Health. And here, one point we must always see that while it is convergence, One Health never states that we are sacrificing the individual professional expertise and the knowledge that are having. Rather, we are trying to interweave all these so that the better outcome comes out. Can we have the next slide? Well, the One Health, if we look into these two terms, here the health is the one which is being qualified by the word one. So health is the one that we are looking into, health for all, I mean, all life forms. And the health history, as we know today, had always been collaborative, and there had been many intersectoral collaborations. Somehow we lost it. And how did we lose it? We can guess and have an idea. If we look into the current paradigms of health, that health, especially in the infectious areas of the health, where we deal with the infectious agents, that started essentially in the 19th century with the great microbiological revolution. At that time, the giants like Robert Koch, Louis Pasteur, and many others were coming up every day with the etiology of the diseases, etiology of the causes. And we came to know that the microbes are so important. It was a microbiological revolution. We came to know that the food industry is also affected by microbes with Pasteur's seminal work, and Robert Koch, Theodore Escherichia, many were there. So as this knowledge domain grew, the things became biomedical science, and the scientists, of course, became more specialized. As the specialization came, separate specialized disciplines and boundaries were created. Organizational setups were created, and as they were created, more and more specialization went ahead. But these were all fine, more specialized knowledge where human endeavor in search of knowledge was going on. But in the 20th century, we found that that some microbes, some diseases, some health problems affect both animals and humans. And when we wanted to identify these problems, that how do we solve it, we found that the disease is identified by one set of people, one set of experts, while the origin lies in the other side, maybe in the primary production line of the crop or the animal foods. So we needed that there are the sub-control gaps in the zoonotic diseases, especially, which affects, which are essentially animal diseases and affects humans. So with this in mind, in the 20th century, it was thought that we need a convergence, and these two branches were merged into veterinary public health, which the veterinary side of the knowledge to be put into the use of the public health, and the Office of Veterinary Public Health was established in Centers for Disease Control as well as in World Health Organization. Please go ahead. Next slide. Now with this, as over the years, One Health concept developed, and as we develop, now we come to a highly intensified livestock industry now in many parts of the world. And let us look into the livestock's role into the food and nutritional security. As we know, the current estimates show that by 2030, we need 1 billion more mouths to be fed. And these directly links to the SDGs like no poverty, zero hunger, good health, well-being. And they are also, this livestock sector is employment generating, which addresses the SDG 8. Globally, almost 20% of our calorific intake and 39% rather, the 40% of the protein comes from the animal source, apart from the essential nutrients like iron, calcium, and vitamin B12. So it seems that the livestock is so integral to our nutritional and food security, we cannot dispense away with that. We have to live with them. Can we have the next, please? In India, India is having the largest share of livestock in the world, except the poultry. They are in number runs in billions, and approximately 20.5 million people depend on the livestock sector for livelihood. That's the population of Portugal and 2 times which are employed in the livestock sector only in India. It provides employment to the 8.8% of the population and contributes immensely, almost 4% of the GDP just alone. Can we have the next slide, please? While this livestock sector is important, it is also threatened by many livestock diseases. And in those top 10 diseases, as I got from the National Animal Disease Reporting System, the top disease that is reported as the coccidiosis that affects poultry, and that is very relevant. Can we go into the next slide? Now let us look into the animal health system, how they are managed by. While there are so many diseases, so many livestock, the largest number of livestock, yet how it is managed. Due to the cooperative federal structure of the country, it is managed simultaneously both by the federal or the central government as well as the state government, and both play an important and complementary role. Next, please. And the animal health information and these disease information pathway is quite complex, and it runs from the grassroots level at the villages and moves up all the way to the Ministry of Agriculture and currently Ministry of Animal Husbandry. And it's a complicated pathway with many players. Can we have the next, please? Yet it is this sector is severely understaffed. Only about 65,000 or 66,000 veterinary institutions, which many of which are not managed by veterinarians, are responsible for managing the livestock disease and all these animal health challenge to address. Can we have the next? In India, animal health system is essentially, if we look into the existing way that is work, in national level, there are two major organizations, National Animal Disease Reporting System and AICRP on address, and ADMAS, which stands for Animal Disease Monitoring and Surveillance. One is managed by ICR Nivedi, the second one, the first one is by Ministry of Fisheries, Animal Husbandry and Dairy. And there is hardly any collaboration with any other sector. Another aspect is the wildlife health. Wildlife health, though India has a large population of wildlife, there is no systematic health monitoring, and it is managed by another separate ministry. So we see the disjoint between these while we are all managing the animal health. Next slide, please. Similar situation is in the human health system. It is essentially vertical disease control programs managed by Ministry of Health. There are many autonomous organizations like National AIDS Control Organization, RNTCP, Vector Control Program, many others are there. These work without the collaboration with others, and there is intersectoral collaboration or with the One Health approach is taken very rarely. Ad hoc basis, they may include some veterinary expert or maybe environmental expert for a particular investigation, but there is no any structured situation. Recently, integrated disease surveillance program has been taken up by the government of India, yet it does not have much effect on the ground. Next, please. On the agricultural and environmental scenario is even more disjointed. Water quality, which is a single item, is managed by Central Pollution Control Board as well as Central Water Commission. Soil health is managed by Indian Council of Agricultural Research as well as state government. Food safety is managed by Ministry of Health with the Food Safety and Standards Authority of India, along with others like APEDA, which falls under another ministry, that is Ministry of Commerce. On the other hand, weather data, which is vital to all diseases, are managed by Indian Meteorological Department. So we see the clear disjoint or the non-coordination among all these agencies. So while all these data are important for managing diseases in animal as well as in humans. Let's go to the next slide. In national status, we have some existing collaborations like National Disease Control Center, Standing Committee on Zoonosis. Some state level are also there. Some two research agencies, ICAR, which I belong to, and Indian Council of Medical Research, also have some joint programs, but those are mostly research oriented. Next, please. Next slide, please. Well, now if we, with this backdrop, we look into the animal health challenges that may require the One Health intervention, especially the complex problems. Here we see that animal health side are always with the have some problems, especially that are major problems include the disease emergence and pathogen spillover. We know the SARS episodes, Nipah episodes, increasingly complex food product system with the globalization of food and agricultural services and supply chain boom. inappropriate use of antimicrobials and other chemicals, intensified aquaculture, unsustainable growth in the livestock and poultry population, poor biosecurity, poor conditions of the animal welfare, and irresponsible pet ownership, and wide disparities in the access to the animal health technologies by the farmers. These all are so complex that it definitely requires One Health intervention, which is beyond the scope of the veterinary or the animal health institutions alone. Let's go to the next one. So possibly what we need is that in India, that advocacy and sensitization at all levels, policymakers, practitioners, educational institute, general people, we need a legal framework too. Without the legal framework, it does not work. We do need country and state level offices of One Health and recognition of existing efforts that are in place that needs to be undertaken. Can we have the last takeaway messages? So if we wrap up, we see that human health and well-being is intricately linked with the health of the animal, plant, and environment. Exponential growth of the scientific knowledge led to a reductionist view. We missed the forest for the tree. One Health evolved as an amazingly simple yet powerful idea, which is difficult to implement, but without the structural changes in the way we do business, and converging all these existing individual organizational efforts will rationalize our efforts and guarantee health for all. And in the 21st century, we have already passed 1/5 of it. We need to reassess our institutions, policies, and priorities for the global good through the lens of One Health. Thank you. I must admit, next slide, please. I must admit, I have taken many data from many researchers. I could not individually mention them for the sake of brevity. Thank you for your attention.
Thank you, Dr. Ghatak, for that wonderful presentation. And we have indeed missed our forest for the tree. Thank you for bringing that importance of intersectoral convergence. And if we add the climate change in the milieu of all what you discussed, things may become far more difficult for us in the future if we don't start paying attention now. So with that in mind, let's see the results of poll 1. And 61% of the participants have responded. So I would request the participants who are online to kindly respond to the poll questions. The question was, One Health approach is based on the concept that the health of human, animals, and environment are interconnected. In Indian context, why do you think One Health is important for food safety and food security in India? And to establish transformative approach to increase sorry, I can't read the whole option given over here, but 30% people have responded to this first answer. The second option, 52% people have responded. To strengthen farm surveillance and governance of AMR, 19% people have responded. Production of egg and boilers have been rising, 0% people have responded. So this was a single choice answer, and most of the respondents have gone for option 2. So with that, we are ending poll 1 results, and with the next speaker coming up, we would open our poll 2 as well. And we would request all the participants who are present over here to kindly, respond to this poll, and the results would be announced later. So with that, Dr. Vikas Agrawal, welcome on board, and over to you for your presentations. Thank you, sir.
Thank you, Dr. Anuradha Jain, and good afternoon, good morning, or good evening, depending upon from where you are joining this presentation. So thank you very much for giving me an opportunity to present this very important concept, especially with regard to food safety, on how to balance between animal and food health. So I would be sharing some of my experiences around One Health from the projects which we have been managing. Next slide, please. So food security, next slide. Yeah, food security, as we know that for India, it's a big challenge. for obvious reason, which Professor Khatak has already mentioned in his slide, and he has made my task much easier because he has already set the tone and the background for this. And to feed 1.3 plus billion population, definitely animal products and food coming out of the animal sector play an important role. For example, India is one of the largest producer of the milk, and likewise, they are too much dependence on animal products and animal, for example, meat, poultry, eggs, etc. And without which it would be very difficult to achieve food security in India. Next slide. So, seeing that there is greater interconnection between animals, human, and environment, and food is major interconnect between these three sectors or more sectors with regard to that. And what it also lead to with this interconnection, many pathogens or many diseases also transmit between animals and human and within the environment, and which results in smaller outbreaks to large pandemics. COVID, for example, is one such incident where there's a lot of speculation around that it might have risen from the wet market. So likewise, there are greater chances of diseases, pandemics, epidemics, etc. coming out of it. So for food security, it's not just important that the focus should be to secure the food production or to increase the food production, but also when we talk about food security, the focus should be to ensure safe and good practices at all points of animal or food handling so that A, food remains free of the disease causing pathogens. B, in addition, we need to ensure that animal handlers remain safe and protected from getting infected with diseases, especially zoonotic diseases. And largely within the animal sector, the diseases are prevented with early detection of the diseases and all the component of health diseases which Dr. Khatak has already mentioned. So these are the things which we need to ensure, and why particularly in India. Next slide, please. More importantly, because India is a hotspot for animal diseases outbreak, more because of the reason that 68% of workforce relies on farming, and they are in close contact with animals and poultry, so are at greater chances of getting exposed to the sick and infected animals. And also there has been much incidences of zoonotic diseases, and I would not repeat because much of this has already been said in the earlier presentation. And these outbreaks not only result in high mortality in animals, but also lead to low productivity in terms of leading to kind of food insecurity. Not to talk about the economic losses which family or community or country may face because of these. And and these animal outbreaks are becoming increasingly challenging, especially in India, because of increasingly more livestock density and growing livestock population, which is also needed for food security. So there's a kind of big risk which is increasing, and with all these factors, uh, and to revert and to basically kind of prevent the huge economic losses and other losses, it's needed. Next slide, please. It's needed to have a response, and response has to be cross-sectoral. And as we all know that, and as I have said in my earlier slide, for increased food productivity to ensure food security, it's not only food sector or animal health sector need to work and address this issue. We need to bring people from human agriculture and all other sector, and especially economists, ecologists, and social scientists, because for example, there is a lot of social behavior which is also involved in this. So there has to be greater emphasis on cross-sectoral cooperation and working together. And much of this has already been mentioned by Dr. Khatak in his presentation. And this is very well getting recognized in India. And India is moving towards One Health initiatives, as I have some listed down here. For example, One Health technical support unit are being established at the national and the state level, and National One Health Institute is also getting established in Nagpur, and also there is emphasis on One Health framework. Next slide, please. So I will spend a little bit of time to explain this One Health framework, although most of you would be already be aware of. As you can see in this figure, which I have presented here, there is a lot of crossover of the benefits and of the like benefits and advantages of one sector to others. Like for example, food is one such, when animals can provide a lot of for example food opportunities to humans, and likewise. But with this crossover, many issues and many problems also get overlapped. So for that, we need to have a One Health framework which can provide a platform, A, for efficient disease reporting, B, for resource planning, but also for developing emergency response, and for planning capacity building and other kind of awareness program, and especially having a joint plan. So for that, One Health framework is very important. Next slide, please. So the question is how difficult or easy it is to establish One Health platforms, or One Health framework, or One Health collaboration. I would be largely speaking from the experience from Fleming Fund, which is a UK exported program, which is being implemented across 22 LMICs across Asia and Africa. So although this project specifically focused on AMR, but we did focus on One Health to greater extent, and some of the learning I would be sharing out of this program. First, learning that AMR is gaining attention. As you can see here, that from the Zero region, South and Southeast Asia region of WHO, which has 11 countries. None of these countries had One Health coordination mechanism in 2016. Now 9 of the countries have it. So there's a greater increasing attention which is being given to One Health, which is a positive sign. But also what we are seeing, that animal health still lags behind the human health. As you can see in the graph here, much of the surveillance and much of strengthening of the labs have occurred in the human health, specifically with regard to AMR, with animal health bit lagging behind. So there is kind of balancing which needs to be done in AMR, and that's something which we need to take it for the food security, that if we are trying to set up for One Health framework for food security, we need to ensure that all the sectors get addressed equally. Next slide, please. Um, so next is that action planning without resource planning may not be sustainable. Although AMR, for example, they have got action plans, national action plans, which has already been developed. But having an action plan without the resources or without the costing of the action plan may not result in sustainable solutions or achievable solutions. For example, as Professor Khadak said, that there is greater need to set up the infrastructure, have much more resources into the human resource. We need to invest into building technical capacities. We need to also address some of the issues such as human resource turnover, and also address many issues around kind of from setting up of the infrastructure and to human resource. So for that, we need to have an action plan, because issues are many, and there's a kind of wider areas that we need to cover. So it's very important that we get an action plan done for that, and we need not to cover all the areas in one go, and it can be incremental steps towards achieving something. And but what is important, that we need to allocate resources along with that. Secondly, it's very important to have clear and functional One Health governance, which clear roles and responsibility demarcations, and with budget allocation for One Health governance structure, and with governance structure in place. Without these things, although there could be intent among the individuals, but it would be very difficult to put those One Health governance mechanism in practice. Third point, I would like to say that role of civil society and private sector is very important. And issues like food security cannot be achieved without involvement of private sector, given that the private sector has much more role to play in securing food security, and they are involved in marketing of food products and other things, and they are involved in much big way. Similarly, civil society and technical experts should be involved, and private sector and civil society should be involved from the very start. They should be involved at the planning stage. And for that, it's very important that our technical committees of our governance mechanism are not just limited to government institutions, but also include people from the civil society and from the private sector. Next slide, please. And there is one more important learning, that our structures of the organizations are not very well developed for the collaboration. For example, if a person from a ministry needs to be involved in meetings of One Health forum or technical committee, that we may have to make changes in their terms of reference or in their job description so that they can be involved on those One Health related work, or they can invest their time. So we may have to look at existing organizational arrangement and structure, and without which it would be very difficult to put these things in practice. And similarly, um, with other priorities, with emerging priorities, with other diseases, things may come and go. So, and it may kind of, affect the cross-sectoral coordination. For example, if there is a new disease outbreak in one of the country, what we have noticed that with new disease outbreak, all the entire sector, the doctors and everyone got diverted to that particular disease. So the One Health framework and One Health structures and coordination mechanism need to be agile. And third point, it's a new concept, and it's still an emerging concept. So it would require a lot of awareness creation, not only at the professional level, but also at the policymaker and general public as well. And secondly, India being given a kind of a complex country with many states, so one framework may not fit all the states. For example, what way may work in Kerala may not work in, say, Bihar. So we need to think, how can we have much more agile One Health framework to address these issues. Next slide. So in the end, I would like to leave behind these 5 key messages, these 5 key considerations for true One Health approach. First is action planning. As I already said, action planning is a very good and effective tool for priority setting, for resource planning, and setting roles and responsibility. Second, B, balancing act. I think all the sectors need to be involved at the representation level, at the investment level from the very beginning. And we need to do it intentionally and also ensure that this is being done at all the levels, from the state, from the national to the state, and then to the local level. Third, coordinated response is very much essential for early detection. For example, some of the diseases may get reported only from the human health side. And if we don't have those kind of coordinated response for reporting and for response, then we may not achieve One Health collaboration in true sense. And for that, it's very important that we have data to share, to analyze, and to also plan our response. And for that, we need strengthened surveillance system, and we need capacity in our systems to analyze, especially the early warning signs, and how we can respond and how we can detect outbreak for that matter. And last and most important point is the equity. We need to have special focus on those areas, and all the framework and all those kind of plans, whatever we are developing, we need to ensure that we don't miss out the areas and the section of the population which are more vulnerable and may have more likely chances of getting missed because of their ethnicity, because of their kind of remoteness. For example, gender. Although women, they are in the front of livestock handling, but they may lack access to the services. And how we can ensure, while developing any framework, that all these equity related issues are addressed, um, and we have got enough resources to kind of address all these issues. So these are the key 5 messages, A, B, C, and D and E, which I would like to leave behind while I'm ending my presentation. But I think that one thing which is really great to see that people have started talking about One Health, and it's getting much more and more attention. But something much need to be done with proper kind of allocation of resources and planning in that regard. Next slide. And that's all from my side. Thank you very much. And I would also like to acknowledge the support which is given by my team members here in Mott McDonald Fleming Fund, especially the One Health specialist and human health specialist, which are working with me in that team. Thank you very much.
Thank you, Dr. Agrawal, for that very, very wonderful and comprehensive talk. And if you may permit, we would like to start taking question and answers for both the presenters now. So Dr. Agrawal and Dr. Ghatak, are we ready? Shall we start with the question and answer sessions? So our first question is
Yes, we are.
for both the presenters, and India is host of the G20 this year. One Health has been high on the agenda of G20 for a few years now. India has vowed to carry this on in the presidency. How can we use this for our advantage? Dr. Ghatak, would you like to go first?
Thank you, Dr. Anubradha, for giving me this opportunity. Of course, since India is in the G20 presidency for this term, it will definitely help the One Health practitioners or the proponents to get the political will behind this One Health initiative. We definitely, since the One Health is one of the major idea, I think across the government structure as well as non-government structures, sustained activities involving One Health initiative from the grassroots till the national level and documenting their successes will go a long way to sustain this One Health campaign when the presidency or this G20 focus is over. That's what I think. We need to take up a series of activities, and the push not only should come from the top, the intention should be expressed from the bottom level also.
Thank you, Dr. Ghatak. Dr. Agrawal, would you like to add something?
Thank you very much. I think it's a very good question. G20 presidency and forums like G20, I think this gives a very good advantage of raising an issue to the highest level for advocacy purposes. And since India is president for G20, I think having One Health agenda in the G20 would definitely is a forum where certain One Health related agenda can be pushed. But at the same time, I think what we need to ensure that those kind of efforts do not restrict to G20 related meetings, but also translate into some of the actions and some of the resource allocations. Um, specifically with regard to so much of work to be done. But it's great that, at the G20, this is being raised, and this is being coming from earlier G20 presidencies like Indonesia and Italy. But I think having India at the helm of G20 at this point, much more commitment and much more kind of, direction and leadership need to be taken by India, and we can take this opportunity to push Indian bureaucrats to make that commitment. Thank you.
Thank you so much, Dr. Agrawal, for that response. We have another question that's there, and that's focused for you, Dr. Agrawal, because it's on the Fleming Fund. What is the major challenge with regard to One Health you would like to mention based on Fleming Fund experience? Your presentation has actually partially answered it, but if you would like to add something on it.
Right. Thank you very much. With regard to One Health, if I have to say, the biggest challenge which we see is the representation, equal or balanced representation from all the sectors. And as I have shown in my slide, much more progress has been done on the human health side. And this is not just the investment, but also the representation on how much human animal health is being represented in the issues with regard to AMR. Slowly and slowly, more sectors are getting involved into it. But there are some issues. For example, environment sector is just a new entry into the area of AMR. So some of the sectors are not yet involved when we talk about One Health, especially with regard to AMR. Which is the primary focus of the Fleming Fund. So I think having equal representation of all the sector is one of the challenge which we are facing. And this is mainly because that AMR governance or the chair of AMR governing bodies lies with Ministry of Health. And since this with Ministry of Health, then obviously other sectors, they don't get that much of representation. So I think ideal would be to have the chair of AMR coordination committees or One Health committees above to any ministry. And that's another challenge which I am seeing when we talk about zoonotic diseases, when we talk about One Health initiatives that are being led by DAHD or some other ministries in India. These are mainly led by Ministry of Agriculture or Animal Health Division. But again, we are not seeing that much of representation of human health, or NCDC and ICMR are not that much involved. And whenever there are initiatives of ICMR, then ICAR and NCDC, the animal health side things will not get that representative. So how we can take that representation and governance to one level up so that we can have an equitable kind of representation. That's one. And another is this, that issues are huge. In fact, there are so many areas to be covered. I think having an incremental plan, starting with something small which can be covered, is something is another thing which is a challenge, because getting the coordination done for all the issues is a big challenging task, and we don't have that much resources which we can ensure that. And there are many issues. Many of these I have already covered in the presentation, but I would like to say specifically about these 2 points here. Thank you very much.
Thank you, Professor Dr. Agarwal. This was really wonderful, and I can see one more question that has come up, and that's for both the presenters. And this is probably the last question we'll take for now, because we may be running out of time, but we'll try and answer all the questions for the participants and send them in writing. Why India is behind in planning in One Health? That's one question. Whoever wishes to take it, Dr. Agarwal, Dr. Ghatak, between you.
Mm-hmm. If I can, I would say that India is not behind as far as One Health kind of, for example, I can talk about, say, with respect to AMR. So India was one of the countries which has set One Health National Action Plan for AMR, and also some of the initiatives are being done. Yes, considering that AMR is such a wide subject, having those framework, some of the activities which should have been done earlier are being done now. But some of the things like influenza response, whether it's rabies program, so some of the activities were already done much, so I would not say that India was behind, but yes, scope is wide, and having a One Health national framework and those things, this should have been done earlier, but yes, so, but still there's a good progress in that regard. Dr. Khatak, anything for you to add? Thank you.
Thank you, sir. Thank you, Dr. Agarwal. Thank you. I too completely agree that it is not being behind. If you look into the SAARC countries, of course, you can point out that Bangladesh already had a One Health plan in place before India took this one. Maybe Nepal is working ahead. That's okay, but if you put even all these SAARC countries together, they do not cover the half of India's diversity or the population or the magnitude. For a large magnitude country, it does require more effort. And perhaps I think whatever the efforts were on place, they lacked visibility, not the action actually. They were not properly communicated to all sectors of this one. So maybe the national influenza program that which Dr. Agarwal rightly said, that was done before this One Health fever took up. But that was not highlighted properly. AMR may be now the new model for the One Health collaboration, but I do think India is on the right track. And though it is appearing to be lagging behind, but it is moving steadily and resolutely in the right way. Thank you.
Thank you so much, Dr. Ghatak. And with that, we would probably stop taking questions for now, and we would definitely respond back to people who have asked these questions. The poll is ready for display, the respond to, and I would appreciate if people can go through the responses. Meanwhile, we would definitely like to thank Dr. Ghatak and Dr. Agarwal, because you have actually raised very important areas and issues for us to ponder upon in the coming days or the coming series. And some of some of these points that you have raised, Dr. Ghatak, are regarding the way the coordination mechanisms are being set up, and how do we need to speak to each other for this coordination mechanism at every level when it comes to intersectoral convergence. I think that's a very important point. And while making progress, we can't leave behind our farms, our animals, because human is a social animal, and it lives in coordination with these things, because we need food from agriculture, we need food from poultry, we need food from the sea, and milk from the poultry animals, and all this is in coordination that we have to work. Otherwise, very rightly said, for the want of the tree, you have lost your forest. So we don't want to do that any further. And Dr. Agrawal, your question around, there are ample funds probably available, but I think the approach has to be really phasic now to progress towards achieving success in this whole journey. And also your point on raising the resources, even though resources for now may seem very, may seem a bit fine, but going forward with the increasing need in this area, funding in different forms and from different sector, from different partners, from different organizations, including governments, have to support this area, and more advocacy would be required. More involvement of different sectors, public, private, CSOs, FBOs would be required. And I think one of the important factors that we would require to take into consideration is the community voices and the community engagement going forward, because they are the most important stakeholders as far as AMR is concerned, and as far as the whole intersectoral convergence or surveillance is concerned. And if this particular group of people, which we call community, starts deciding and acting, I think things would get resolved much better as compared to working on the upper stream of the job, because quote unquote, it's very difficult to bring intersectoral convergence at the top levels. And we have always seen intersectoral convergence happening very easily in every sector at the lowest level. So I think we have to start bottoms up as with the community, and I think rest may fall in place going forward. So with that, I think I will hand it over to the organizers to give the final remarks. Over to you, Dr. Rajiv Dasgupta. Thank you.
Thank you very much, Dr. Anuradha Jain. It's my pleasure to thank Dr. Sandeep Ghatak and Dr. Vikas Agarwal immensely for their insightful presentation and enriching this One Health debate in the Indian context. And certainly Dr. Anuradha Jain for steering this discussion. We are very thankful to the audience for attending this session, and as well as posing some critical questions. The technical team at the UK end deserves a special mention for letting this run absolutely seamlessly. You can follow the One Health Hub on Twitter, LinkedIn, and book to stay updated on our research and studies. The onehealthpoultryhub.org is our website. The videos of both the webinars, the current one and the previous one, which was called Beyond Blueprints, Opportunities for Implementing One Health AMR Governance in India, that was held on 20th December. Both will be available on the OHPH website soon. Thank you everyone once again, and we will close this at 4:01 p.m. India. Thank you very much, and bye-bye from all of us at the One Health Poultry Hub.